The heart monitor's shrill alarm cut through the pediatric ICU like a scream in the night, announcing what 22 of the country's top doctors had spent the last 4 hours trying to prevent. At 3:17 in the morning, the 8-year-old boy's vital signs were collapsing, his small body rejecting every intervention, every protocol, every desperate measure they'd thrown at him. Blood pressure dropping, oxygen levels critical, brain activity showing dangerous spikes that meant time was running out faster than anyone wanted to admit. In the hallway outside room 314, a man in a dark blue paramedic uniform stood frozen, his coffee cup forgotten in his trembling hand as he watched the controlled chaos unfold through the observation window. The doctors inside moved with practiced urgency, but Marcus Reed could see what they couldn't or wouldn't admit. They were losing him. Marcus had seen that look before, the way shoulders started to sag when hope began slipping away. He'd witnessed it in field hospitals overseas, in the backs of ambulances racing through city streets, in emergency rooms where miracles were expected but didn't always come. But this time was different. This time, the child fighting for his life behind that glass had eyes the same shade of green as his own son, Trevor. The same stubborn cowlick that refused to stay down, the same scar on his chin from a bicycle accident that had happened 3 summers ago in a park Marcus could never afford to visit. If you're enjoying this story so far, don't forget to hit the like button and subscribe. Drop a comment telling me where in the world you're watching from. I love hearing from you. Marcus Reed wasn't supposed to be in this wing of Metropolitan Children's Hospital. His shift had ended 2 hours ago, but he'd stayed to finish paperwork, to avoid going home to an empty apartment where Trevor's absence echoed in every room. At 34, Marcus had the steady hands and calm demeanor that made him one of the city's most requested paramedics. But tonight those hands shook as he watched a team of specialists fail to save a boy who looked exactly like the son he'd lost to leukemia 6 months earlier. The irony wasn't lost on him. For 3 years he'd fought alongside doctors and nurses to keep Trevor alive, watching them perform miracles with medications and procedures he could barely pronounce. They'd saved his son over and over again, buying time, buying hope, buying moments that had felt like lifetimes. But when the end finally came, it had happened at home. Quietly, with just Marcus holding Trevor's hand and whispering stories about the adventures they'd take when he got better. Adventures they'd never have. The boy in room 314 was named Michael, according to the chart Marcus had glimpsed when the attending physician rushed past him 20 minutes ago. Michael Torres, age 8, son of General Antonio Torres, commanding officer of the 2nd Infantry Division. The general had arrived by military helicopter, his uniform crisp despite the 3-hour flight from Fort Campbell. Marcus had watched through the window as the man, built like a fortress, decorated with ribbons that spoke of a lifetime of service, had been gently but firmly removed from his son's room when the medical team needed space to work. Now the general sat in the family waiting area, his head in his hands, looking smaller than any man with 4 stars on his shoulders should ever look. Every few minutes he'd glance toward room 314, and Marcus could see the same desperate hope and crushing fear he'd carried for 3 years, the same terrible knowledge that all the money in the world, all the power, all the connections meant nothing when death came knocking. Marcus should have left, should have gone home to his studio apartment in Queens, where he kept Trevor's bedroom exactly as it had been, down to the unmade bed and the comic books scattered on the floor. Should have tried to sleep, knowing he had another shift in 8 hours. Should have minded his own business and let the specialists do what they were trained to do. But Michael's heart was failing and the doctors were running out of options. Marcus had been a paramedic for 12 years, ever since he'd aged out of the foster care system, with nothing but a high school diploma and a fierce determination to never be helpless again. He'd learned to save lives because no one had been able to save the people who'd mattered to him. Not his mother, who'd overdosed when he was 7, not his foster brother Danny, who'd been killed in a drive-by shooting at 15, and not Trevor, despite every prayer, every treatment, every sleepless night spent researching experimental therapies. But he was good at what he did. Better than good. Marcus had a reputation among emergency room staff for bringing back patients who should have been beyond saving. He'd performed field surgery with improvised tools, had kept trauma victims alive through 30-minute transport rides that should have been death sentences. His supervisors had pushed him to become a doctor, to get the training that would let him do more than stabilize and transport. But Marcus had seen what the weight of life and death decisions did to people. He'd watched Trevor's oncologist age 10 years in 3, had seen nurses cry in supply closets, had witnessed the toll that came with being responsible for miracles. He preferred the clarity of emergency medicine, where his job was to keep people alive long enough for someone else to save them. It was a boundary that had served him well until tonight, when he found himself watching a child die and knowing exactly what needed to be done to save him. The commotion in room 314 was getting more frantic. Through the observation window, Marcus could see the lead physician, a woman in her 50s with silver hair and a reputation for never giving up, barking orders that were being followed with increasing desperation. Chest compressions, medication adjustments, a defibrillator being charged for what Marcus counted as the 4th time in 10 minutes. Michael's body was small on the adult-sized hospital bed, connected to machines that beeped and hummed with mechanical precision. His dark hair was matted with sweat, his olive skin pale in the harsh fluorescent lighting. He wore a hospital gown printed with cartoon dinosaurs, the kind of detail that made Marcus's chest tight with memories of Trevor's collection of superhero pajamas. The boy's father had been pacing the hallway for the past hour, his military bearing intact despite the circumstances. General Torres moved with the controlled energy of a man used to command, but his eyes held the helpless frustration of someone discovering that authority meant nothing in the face of pediatric cardiology. Every time a doctor emerged from Michael's room, the general's shoulders would straighten, his jaw would set, and he'd prepare to receive news with the same composure he'd probably used to brief presidents and field commanders. But Marcus could see the cracks forming, the way the general's hands clenched when he thought no one was looking, the slight tremor in his voice when he demanded updates from the nursing staff, the careful distance he maintained from the observation window, as if getting too close might somehow make the situation more real. Marcus recognized all of it because he'd lived all of it. The bargaining with God, with fate, with anyone who might be listening. The desperate need to do something, anything, when the only thing you could do was wait and hope that people you'd never met before tonight could perform the kind of miracle you'd take on any mission, face any enemy, sacrifice anything to achieve yourself. The difference was that Marcus actually could do something. The pediatric intensive care unit at night was a different world from the daytime chaos of a children's hospital. The lights were dimmed, the voices hushed, the very air seeming to hold its breath around the small patients fighting battles that would have broken grown men. Marcus had been in this unit too many times during Trevor's treatment, had memorized the layout of machines and monitors, had learned to read the subtle signs that meant the difference between a good night and a crisis. Room 314 was having a crisis. Marcus set down his coffee cup and took a step closer to the observation window. Inside, he could see the attending physician, Dr. Sarah Chen, according to the nameplate outside the door, standing at the foot of Michael's bed, with a tablet in her hands, scrolling through what Marcus assumed were treatment options they hadn't tried yet. Around her, the team moved with the kind of controlled urgency that meant they were approaching the end of their protocol list. A young resident stood at the head of the bed, manually ventilating Michael with steady, rhythmic compressions of a bag valve mask. His technique was textbook perfect, but Marcus could see the strain in his shoulders, the way his eyes kept darting to the heart monitor, as if willing the numbers to improve. Two nurses flanked the bed, one adjusting IV medications with precise, practiced movements, the other monitoring the bank of machines that were keeping Michael alive. Both women had the kind of calm competence that came from years of pediatric intensive care, but Marcus could see the tension in their postures, the way they moved just a little too quickly, spoke just a little too quietly. And then there was Michael himself, small and still in the center of all this activity. His chest rose and fell with mechanical precision, driven by the ventilator that had taken over when his own respiratory system began to fail. The monitors showed heart rhythms that were growing increasingly erratic, blood pressure readings that made Marcus's own pulse quicken, oxygen saturation levels that were trending in exactly the wrong direction. Marcus had seen this pattern before in the field and in emergency rooms, when a patient's body was shutting down system by system, despite every intervention modern medicine could offer. It was the look of a fight being lost, of protocols being exhausted, of a moment approaching when someone would have to make the decision to stop trying. But Marcus could also see what the doctors inside might be missing, focused as they were on their specialized equipment and advanced procedures. Michael's color was wrong, not just the pallor of critical illness, but something more specific. His neck veins were distended, visible even from Marcus's position outside the room. His chest didn't move quite right with the ventilator's rhythm, suggesting something the machines weren't detecting. These were field signs, the kind of observations paramedics learned to make in the back of ambulances, where diagnostic equipment was limited and decisions had to be made on instinct and experience. Marcus had learned to read bodies like maps, to recognize the subtle signs that often told a different story than the monitors and lab results. What he was seeing suggested a tension pneumothorax, a condition where air trapped in the chest cavity prevented the heart from filling properly. It was something that could develop suddenly, especially in a child who'd been on a ventilator for an extended period. It was also something that could be fixed if someone recognized it in time and had the skill to act. The problem was that Marcus wasn't supposed to be here, wasn't part of the medical team, wasn't authorized to diagnose or treat patients in this hospital. He was a paramedic whose shift had ended hours ago, whose presence in the pediatric ICU could be questioned by security if the wrong person noticed him lingering outside a patient's room. But Michael Torres was dying, and Marcus Reed knew how to save him. The general's phone rang, sharp and insistent in the quiet hallway. General Torres answered on the first ring, his voice low but carrying the authority that came with decades of command. Marcus couldn't make out the words, but he could hear the tone, controlled, professional, the voice of a man briefing subordinates on a developing situation. The conversation lasted less than a minute. When the general hung up, he stood for a moment with the phone in his hand, staring at it as if it might ring again with different news. Then he slipped it into his uniform pocket and resumed his position near the waiting area chairs, close enough to room 314 to see any change in activity, far enough away to give the medical team space to work. Marcus wondered what kind of calls a general fielded at 3:30 in the morning when his son was fighting for his life. Orders that couldn't wait, briefings that couldn't be postponed, the kind of responsibilities that followed men like Torres, no matter what personal crisis they might be facing. The weight of command didn't take sick days, didn't pause for family emergencies, didn't care that sometimes the most powerful man in the room was also the most helpless. Inside room 314, the activity was becoming more urgent. Dr. Chen was now standing at the bedside, her hands moving over Michael's chest with the kind of examination that suggested she was looking for something specific. The monitors continued their digital alarms, numbers flashing red as Michael's condition continued to deteriorate. Marcus watched Dr. Chen's face, saw the moment when her expression shifted from determined focus to something approaching concern. She was a good doctor, experienced and skilled, but pediatric intensive care was different from emergency medicine. The signs Marcus was reading might not be as familiar to someone who spent most of their time managing long-term critical care rather than acute trauma. The resident was saying something to Dr. Chen, gesturing toward one of the monitors. She nodded, then stepped back from the bed to consult her tablet again. Marcus could see her scrolling through what looked like diagnostic protocols, searching for the next step in a process that was running out of steps. Time was running out too. Marcus had learned, during Trevor's illness, that hospitals operated on a different timeline than the outside world. Minutes could stretch into hours when you were waiting for test results. Hours could compress into seconds when a crisis developed. The trick was learning to read the signs, to understand when the careful pace of institutional medicine was moving too slowly for the reality of what was happening. Right now, that pace was too slow for Michael Torres. Marcus took another step closer to the observation window, close enough to see the details that would confirm his field diagnosis. Michael's jugular veins were definitely distended, visible even under the harsh hospital lighting. His trachea appeared shifted slightly to one side, a subtle sign that most people wouldn't notice but that screamed pneumothorax to someone trained in emergency medicine. The ventilator was working harder than it should, the pressure readings higher than normal for a child Michael's size. His blood pressure was dropping despite multiple medications designed to support it. His heart rate was climbing as his cardiovascular system struggled to compensate for the mechanical problem that was preventing proper circulation. All classic signs of tension pneumothorax, a condition that required immediate decompression to save the patient's life. It wasn't a complex procedure. Marcus had performed it dozens of times in ambulances and emergency departments, but it required quick recognition and decisive action, two things that were often complicated by hospital protocols and chains of command. Dr. Chen was still consulting her tablet, still following the systematic approach that made sense in most situations, but was exactly wrong for this one. She needed to stop thinking like an intensivist managing a complex case and start thinking like an emergency physician dealing with an acute crisis. She needed to decompress Michael's chest, and she needed to do it now. Marcus looked at his reflection in the observation window, seeing a man in a rumpled paramedic uniform who had no business being in this hallway, let alone considering intervention in a case being managed by specialists. His supervisor would fire him. The hospital administration would ban him. His paramedic license could be suspended for practicing outside his scope in an institutional setting. But Trevor's eyes looked back at him from Michael's face, and none of that mattered anymore. Marcus straightened his shoulders, checked his watch, 3:42 in the morning, and walked toward the door of room 314. The automatic doors to room 314 whispered open as Marcus stepped inside, his heart hammering against his ribs. The controlled chaos he'd observed from the hallway was even more intense up close, the constant beeping of monitors, the hiss of the ventilator, the quiet urgency in every voice. Dr. Chen looked up from her tablet, her expression shifting from concentration to confusion as she registered the paramedic uniform. "Excuse me, you're not authorized to be in here," she said, her voice professional but firm. "This is a restricted unit." Marcus raised his hands, palms visible, the universal gesture of someone who meant no threat. "Dr. Chen, I'm Marcus Reed, paramedic with Metro EMS. I was finishing paperwork downstairs when I heard the code. That boy has a tension pneumothorax. You need to decompress his chest immediately. The resident at the head of the bed stopped his ventilation rhythm for a split second, glancing between Marcus and Dr. Chen. Around the room, the two nurses paused in their tasks, the sudden stillness making the monitor alarm seem even louder. A what? Dr. Chen's eyebrows drew together. We've run full diagnostics. There's no indication of... Look at his neck veins, Marcus interrupted, stepping closer to the bed but keeping his hands visible. Jugular vein distension. His tracheas shifted to the left. You can see it if you look at the angle of his airway. The ventilator pressures are climbing because you're fighting trapped air in his pleural space. Dr. Chen moved to the side of the bed, her trained eyes following Marcus's observations. The resident leaned forward, studying Michael's neck with new attention. One of the nurses, an older woman with gray-streaked hair, nodded slowly. He's right about the pressures, she said quietly. They've been climbing for the past 10 minutes. This is highly irregular, Dr. Chen said, but Marcus could see her mind working, processing the signs he'd pointed out. You're not even supposed to be in this unit. How do you know this patient? Marcus felt the weight of the truth settling on his shoulders. I don't know him, but I know what I'm seeing, and I know you've got maybe 2 minutes before his cardiovascular system shuts down completely. The heart monitor chose that moment to emit a different alarm, the kind that made everyone in the room freeze. Michael's blood pressure was dropping into dangerous territory, the numbers on the screen painting a picture of impending cardiac arrest. Dr. Chen looked at the monitor, then at Michael, then back at Marcus. Her training warred with the evidence in front of her, the systematic approach of intensive care clashing with the rapid decision-making of emergency medicine. If you're wrong, she began. If I'm wrong, you continue what you're doing, Marcus said. If I'm right and you don't act, he dies. Right here, right now. The silence stretched for 3 heartbeats. Then Dr. Chen straightened, her decision made. Nancy, get me a 14-gauge needle and prep for thoracic decompression. Tom, she addressed the resident, maintain ventilation but reduce the pressure. We don't want to worsen a pneumothorax if there is one. The room exploded into motion. Nancy, the gray-haired nurse, moved to the supply cabinet with practiced efficiency. Tom adjusted the ventilator settings, his young face tight with concentration. Dr. Chen positioned herself at Michael's bedside, her hands moving over his chest to identify the precise location for needle insertion. Second intercostal space, mid-clavicular line, Marcus said quietly, his voice carrying the calm authority that had served him well in hundreds of emergency situations. You're looking for the space just below his collarbone, right side. Dr. Chen's fingers found the landmark, her touch gentle but sure. I've got it. She looked up at Marcus, something shifting in her expression. You've done this before. It wasn't a question, and Marcus didn't treat it like one. More times than I want to count. The needle went in smoothly, angled precisely, and for a moment, nothing happened. Then came the distinctive hiss of escaping air, the sound that confirmed what Marcus had diagnosed from outside the room. Michael's chest seemed to settle, the mechanical fight between his body and the ventilator, easing as the trapped air escaped. Almost immediately, the monitors began to show improvement. Blood pressure stabilizing, heart rhythm becoming more regular. Oxygen saturation climbing toward normal ranges. My God, Tom whispered, his hands still on the ventilation bag. How did you see that when we missed it? Marcus watched Michael's color begin to improve, the gray pallor giving way to healthier pink tones. Different training. In the field, you learn to look for patterns that don't always show up on monitors. Dr. Chen was securing the needle, ensuring the decompression remained stable. Her movements were sure, professional, but Marcus could see the questions forming behind her eyes. When she finished, she straightened and looked at him directly. "That was field medicine," she said. "Combat field medicine, if I'm not mistaken. The way you read those signs, the confidence in your diagnosis. That's not standard paramedic training." Marcus felt the familiar tightness in his chest, the weight of memories he'd spent years trying to bury. "I served overseas, before I became a paramedic." "Where?" Dr. Chen's voice was gentle now, the crisis past and genuine curiosity replacing professional suspicion. "Afghanistan, 2 tours as a combat medic." The words came out clipped, efficient, the way Marcus had learned to talk about his service when he had to talk about it at all. Nancy was adjusting Michael's IV medications, fine-tuning the support his system needed as it recovered from the crisis. Tom had resumed normal ventilation patterns, the mechanical rhythm steady and reassuring. The room felt different now, the desperate urgency replaced by cautious optimism. "That boy would have died," Dr. Chen said quietly. "We would have lost him while we were running through diagnostic protocols." Marcus shook his head. "You would have figured it out. Maybe not in time, but you would have gotten there." "Maybe." Dr. Chen studied him with the kind of attention she usually reserved for complicated cases. "What's your last name, Marcus? I want to make sure this intervention is properly documented." "Reed. Marcus Reed." He glanced at the door, suddenly aware that he'd been in the room for nearly 10 minutes. "I should go. I'm not supposed to be here, and I don't want to cause problems for you or your team." "Wait." Dr. Chen's voice stopped him at the threshold. "I want to understand something. You're a paramedic. You bring patients to us. You don't treat them in our ICU, but you just saved this child's life using skills that most emergency physicians don't have. Why aren't you a doctor?" The question hit Marcus like a physical blow, bringing back conversations with military physicians who'd pushed him toward medical school, with Trevor's oncologists who'd recognized his intuitive grasp of complex conditions, with supervisors who'd suggested he was wasting his talents on an ambulance. "Some paths aren't meant to be taken," he said finally. "Some people are meant to do one thing well instead of trying to do everything." Dr. Chen didn't look satisfied with the answer, but she nodded. "Thank you, Marcus Reed. Whatever your reasons for being here tonight, I'm grateful you were." Marcus left room 314 and walked directly into General Torres. The general stood in the hallway like a monument to controlled anxiety, his uniform still crisp despite the hours he'd been pacing. His eyes were red-rimmed with exhaustion but alert, focused on Marcus with the kind of attention that made it clear this wasn't a casual encounter. "You're the paramedic," the general said. It wasn't a question. Marcus straightened instinctively, muscle memory responding to the authority in the general's voice. "Yes, sir. I watched through the window. I saw what happened in there." General Torres stepped closer, his gaze taking in Marcus's uniform, his bearing, the way he stood when addressed by a superior officer. "You saved my son's life." "Dr. Chen and her team saved your son's life, sir. I just pointed out something they might have missed." "Don't." The word came out sharp, carrying the weight of command. "Don't diminish what you did. I've been in enough firefights to recognize real skill when I see it." Marcus felt exposed under the general's scrutiny, as if those experienced eyes could see through the paramedic uniform to the soldier underneath. "I was just doing my job, sir." "No, son. Your job ended hours ago. What you did in there, that was something else entirely." General Torres crossed his arms, the gesture making his ribbons catch the fluorescent light. "How long did you serve?" The question was inevitable, Marcus realized. He'd walked into this hallway wearing his military training like a second skin, and Antonio Torres hadn't earned 4 stars by missing details. 6 years, sir. Army medic, 10th Mountain Division." "Afghanistan?" "Yes, sir. 2 deployments." General Torres nodded slowly, pieces falling into place behind his eyes. Combat medic. That explains the diagnostic skills, the confidence under pressure. He paused. It doesn't explain why you're working as a paramedic instead of practicing medicine. Marcus felt the familiar weight of that question, the one that followed him through job interviews and performance reviews, through conversations with colleagues who couldn't understand why someone with his skills chose to work in the field instead of pursuing advanced training. If you're hooked on this story, make sure to subscribe and turn on notifications so you never miss an upload. Your support means everything and helps me bring you more emotional stories like this one. Some transitions are harder than others, sir, Marcus said carefully. The general studied him for a long moment, recognition flickering in his expression. PTSD, among other things. Marcus met the general's eyes, seeing, understanding. There. I found work that lets me help people without carrying the weight of long-term responsibility. It suits me. Does it? General Torres's voice carried a note of skepticism. Because what I saw in that room wasn't a man avoiding responsibility. That was a man stepping up when everything was on the line. Before Marcus could respond, Dr. Chen appeared in the doorway of room 314. General Torres, I have good news. Michael's responding well to the intervention. His vitals are stabilizing and we're optimistic about his recovery. The change in General Torres was immediate and profound. The military bearing remained, but something fundamental shifted in his posture, a loosening of tension that had been held for hours. Can I see him? Of course, he's still unconscious, but his condition is much improved. General Torres turned to Marcus before following Dr. Chen. This isn't finished, he said quietly. I owe you a debt that can't be repaid with thanks. Marcus watched the general disappear into room 314, then leaned against the wall, suddenly exhausted. The adrenaline that had carried him through the crisis was fading, leaving behind the familiar hollow feeling that came after every emergency, every save, every moment when training and instinct had been enough to hold death at bay. He thought about Trevor, about all the times he'd stood in hallways like this one, hoping for miracles that sometimes came and sometimes didn't, about the doctors and nurses who'd fought alongside him, who'd shared the weight of hope and fear that came with loving someone whose life hung in the balance. Tonight he'd been on the other side of that equation. Tonight he'd been the one providing the miracle instead of praying for it. The thought should have felt good, should have provided some sense of closure or purpose. Instead, it left him feeling more hollow than ever, reminded of everything he'd walked away from and couldn't quite explain why. Marcus? Dr. Chen's voice pulled him from his thoughts. She stood in the doorway again, her expression thoughtful. Can I ask you something? Sure. How did you know? I mean, really know. Tension pneumothorax isn't uncommon, but the way you diagnosed it from outside the room, the certainty in your voice, that's not standard training. Marcus considered his answer carefully. I had a son, he said finally. Trevor. He spent 3 years in and out of hospitals before he died. You learn to read the signs when someone you love is fighting for their life. Dr. Chen's expression softened. I'm sorry for your loss. Thank you. Marcus pushed off from the wall, ready to leave, to go home to his empty apartment and try to process what had happened tonight. Marcus, Dr. Chen called after him again. Have you ever considered coming back to medicine, not as a paramedic, but as a physician? The question followed him to the elevator, echoed in his mind during the subway ride back to Queens, lingered as he sat in his kitchen at 5 in the morning, drinking coffee and watching the sun rise over a city that never slept. Have you ever considered coming back? The answer was yes, of course he had. Every time he walked away from a hospital, every time he handed a patient over to emergency room staff, and wondered what happened next. Every time he used skills that could have been developed into something more. But coming back meant taking responsibility for outcomes, meant carrying the weight of decisions that could save lives or end them. It meant risking the kind of failure that had already broken him once, when Trevor's cancer had progressed. Despite every treatment, every prayer, every desperate measure Marcus had researched in medical journals, he wasn't qualified to understand. It meant opening himself up to the possibility of loss all over again. Marcus finished his coffee and looked at the empty chair across from his small kitchen table, the place where Trevor used to sit every morning before school, chattering about homework and friends and the comic book characters he wanted to be when he grew up. Maybe some risks were worth taking. Maybe some paths were worth walking, even when you couldn't see where they led. Maybe saving Michael Torres had reminded him that healing wasn't just about avoiding pain. Sometimes it was about choosing to feel it, to carry it, to let it transform you into someone who could help carry it for others. His phone buzzed with a text message from an unknown number. "This is General Torres. I have a proposition for you. Can we meet for breakfast?" Marcus stared at the message for a long moment, then typed back, "Yes, sir. Where and when?" The response came immediately. "Golden Diner on Northern Boulevard, 800 hours. And Marcus, thank you again for my son." Marcus set the phone down and looked around his apartment, seeing it as if for the first time. The medical textbooks on his shelves, dusty but still there. The framed certificate from his combat medic training hanging next to Trevor's school photos. The careful emptiness he'd cultivated, designed to protect him from the kind of hope that could be shattered. Tonight had changed something. Tonight had reminded him that some kinds of emptiness weren't protection. They were prisons. At 7:30, Marcus showered and dressed in civilian clothes, trading his paramedic uniform for jeans and a button-down shirt. He looked at himself in the bathroom mirror, seeing a man who'd spent 6 years trying to find a safe middle ground between the skills he possessed and the responsibilities he feared. Maybe it was time to stop looking for safety and start looking for purpose. Maybe it was time to find out what General Antonio Torres wanted to propose. The Golden Diner on Northern Boulevard had seen better decades, but the coffee was strong and the booths offered privacy. Marcus arrived at 7:55, military punctuality still ingrained after all these years. General Torres was already there, sitting in a corner booth with his back to the wall, wearing civilian clothes that somehow made him look more imposing, not less. The man commanded attention even in khakis and a polo shirt. "Marcus." The general stood to shake his hand, his grip firm and brief. "Thank you for coming." They settled across from each other, the Formica table scarred with decades of use. The general had already ordered coffee for both of them, and Marcus found himself grateful for the familiar ritual of wrapping his hands around a warm mug. "How's Michael?" Marcus asked. "Awake, asking for his Nintendo Switch and complaining about the hospital food." General Torres's smile was tired but genuine. "The doctors say he'll make a full recovery. They also say that without your intervention, we'd be having a very different conversation this morning." Marcus nodded, unsure how to respond to gratitude he still didn't feel he'd earned. "I'm glad he's doing better. Dr. Chen told me about your son." The general's voice was gentle, careful. "I can't imagine what you've been through." The words hit Marcus in the chest, unexpected in their directness. Most people danced around Trevor's death, offered vague condolences that let them avoid the raw reality of a child's lost future. General Torres met it head-on, the way someone who delivered death notifications to military families would understand the weight of specific, irreplaceable loss. "Trevor would have loved Michael's dinosaur pajamas," Marcus said quietly. "He was obsessed with paleontology, wanted to dig up fossils in Montana when he grew up." Tell me about him." So Marcus did. In a diner booth at 8 in the morning, he found himself talking about Trevor's laugh, about the way he'd insisted on wearing his Superman cape to chemotherapy appointments, about how he'd memorized the names of every nurse on the pediatric oncology ward and made them birthday cards from construction paper and crayons. General Torres listened without interrupting, his attention complete and focused in the way that made it clear this wasn't small talk or obligation. This was one father honoring another's loss, understanding that some stories needed to be told to people who could hear them properly. "He sounds like he was an extraordinary kid," the general said when Marcus finished. "He was, and I failed him." "How?" The question was direct, challenging, delivered with the kind of authority that expected honest answers. Marcus felt himself straightening, responding to the tone even as he resented it. "I couldn't save him. All that training, all those skills, and when it mattered most, I was useless. I had to watch other people try to perform miracles while I stood in hallways feeling helpless." General Torres leaned forward, his eyes intense. "Let me tell you something about failure, son. Real failure is having the ability to help and choosing not to use it. What you did last night, that wasn't a man running from failure. That was a man who'd learned from it. You don't understand. I understand more than you think." The general's voice carried a weight that stopped Marcus mid-sentence. "Michael wasn't my first son." The words hung between them, heavy with implication. Marcus waited, sensing that whatever came next would explain the shadows he'd seen in the general's eyes, the careful way he'd held himself during the crisis. "David was my oldest, born when I was a young lieutenant, full of plans and certainty about how the world worked." General Torres's hands were steady around his coffee mug, but Marcus could see the tension in his shoulders. He was killed in Iraq, IED on a routine patrol. He was 22 years old. Marcus felt the familiar ache of recognition, the way loss called to loss across the space between people who'd been broken by it. "I'm sorry. David died because I taught him that duty meant following orders, that good soldiers didn't question authority, that the mission always came first." The general's voice was matter-of-fact, but Marcus could hear the years of guilt beneath it. He radioed in concerns about the route his unit was taking. His commanding officer overruled him. David could have refused, could have insisted on a different approach, but he followed orders because that's what I'd taught him to do. The diner's background noise faded as Marcus absorbed what he was hearing. General Antonio Torres, a man with 4 stars and decades of command experience, was confessing to a failure that had cost him his son. "For years after David died, I told myself that leadership meant making the hard decisions, carrying the weight so other people didn't have to. I threw myself into my career, rose through the ranks, convinced myself that success was the best way to honor his memory." General Torres met Marcus's eyes directly. "Then my wife left me, said I'd chosen the army over my family, that I was more committed to other people's sons than to the one I had left." Michael, who was 8 years old and barely knew his father because that father was always somewhere else, making decisions that affected thousands of people, while his own son grew up with nannies and boarding schools. The general's smile was bitter. "I was so afraid of failing another child that I never gave myself the chance to succeed with him." Marcus understood now why General Torres had looked so small in that hospital waiting room. It wasn't just fear for Michael's life. It was the weight of years of missed opportunities, of relationships sacrificed on the altar of professional duty. What changed? Last night, watching you step into that room, seeing you use skills you'd been hiding from because you were afraid of failing again, that changed everything. General Torres leaned back, his expression thoughtful. You saved my son. But more than that, you reminded me that hiding from responsibility isn't the same as avoiding failure. Sometimes it's just another way of guaranteeing it. Their breakfast arrived, eggs and toast for Marcus, oatmeal for the general, but neither man touched their food immediately. The conversation had shifted into something deeper than either had expected, the kind of honesty that happened between people who'd looked directly into loss and somehow found their way back. "I have a proposition for you," General Torres said finally. "There's a position opening up at Walter Reed, head of emergency medicine for the trauma unit. It's a civilian position, but it works closely with military medical staff. The job requires someone with both combat experience and advanced medical training." Marcus felt his stomach drop. "General, I appreciate what you're trying to do, but I'm not a doctor. I never finished medical school, never completed residency." "You could." The general's voice was calm, certain. "There are accelerated programs for military medics with extensive field experience. The VA has initiatives designed specifically for people like you, combat veterans who developed advanced skills in non-traditional settings. That would take years. I can't afford—" "I can." General Torres held up a hand to forestall Marcus's objection. "Not as charity, not as payment for what you did last night. As an investment, the military needs doctors who understand trauma, who can make decisions under pressure, who've learned to save lives with limited resources. You've already proven you have those skills." Marcus stared at his untouched eggs, his mind racing. The offer was everything he'd once dreamed of, and everything he'd convinced himself he didn't deserve. The chance to practice real medicine, to use his skills where they could make the biggest difference, to honor Trevor's memory by saving other children. "Why?" he asked finally. "Why would you do this for someone you just met?" "Because last night you reminded me that second chances aren't given, they're taken. And because I think we both need to learn that running from responsibility isn't protecting anyone. It's just another way of failing." The general's phone buzzed, and he glanced at it with the quick, efficient attention of someone always managing multiple priorities. "That's the hospital. Michael wants to know if the paramedic who helped him is coming to visit today." Marcus felt something crack open in his chest, a wall he'd built around the part of himself that still believed healing was possible. "He wants to see me? He wants to thank you. Apparently he's been asking Dr. Chen medical questions all morning, and she told him that you're the one who spotted what the doctors missed." General Torres smiled. "He says he wants to be a paramedic when he grows up. Says regular doctors are good, but paramedics are superheroes who save people before the doctors even know they need saving." The image of Michael Torres, alive, awake, planning his future, hit Marcus like a physical blow. This was what he'd been running from, the possibility that his skills could matter, that his presence could make the difference between life and death, that healing others might be the path to healing himself. "I'll visit," Marcus said quietly. "But General, about the medical school proposal. I need time to think about it." "Take all the time you need, but while you're thinking, consider this. Trevor fought his battle with everything he had. He never gave up even when the outcome was uncertain. Maybe it's time you fought yours the same way." General Torres left money on the table and stood to go. "I'll be in town for another week while Michael recovers. If you want to discuss this further, you have my number." Marcus watched him leave, then sat alone in the diner booth for another hour, staring at coffee that had gone cold while his mind wrestled with possibilities he'd spent years refusing to consider. That afternoon he visited Michael Torres. The boy was sitting up in bed, his dark hair messy from sleep, his eyes bright with the resilience that belonged uniquely to children who'd survived something they didn't fully understand. He broke into a grin when Marcus appeared in the doorway. "You're the paramedic. Dad told me you saved my life. Marcus approached the bed carefully, struck again by how much Michael looked like Trevor had at that age. How are you feeling, buddy? Way better. The doctor said my lung was squished, but you fixed it. That's so cool. Did you learn that in an ambulance? I learned it in the Army, actually. I was a soldier before I became a paramedic. Michael's eyes went wide. Were you in a war? Yeah, I was. Did you save lots of people? The question was innocent, direct, the kind children asked without understanding the weight their answers might carry. Marcus found himself thinking about the soldiers he'd treated in field hospitals, about the lives he'd managed to save and the ones he hadn't, about the way combat medicine was both more and less than what civilian emergency work demanded. I tried to, Marcus said finally. Sometimes it worked, sometimes it didn't, but I always tried. Michael nodded sagely, as if this made perfect sense to his 8-year-old worldview. Dad says trying is the most important part. He says even when you're scared, you have to try to help people. Your dad sounds pretty smart. He is. He's a general, but he's also my dad. He used to work all the time, but he says that's going to change now. He says almost losing me made him remember what's really important. Marcus felt the truth of that statement settle into his bones. Almost losing someone, whether through illness, injury, or the slow erosion of distance, had a way of clarifying priorities that nothing else could match. What do you want to be when you grow up? Marcus asked. A paramedic like you, or maybe a doctor, or maybe both. Dr. Chen says some doctors used to be paramedics first. Is that true? Yeah, it's true. Some of the best doctors I know started in the field. Will you teach me? When I'm older, I mean. Dad says you know things that most doctors don't. The request hit Marcus unexpectedly. The simple faith of a child who believed that adults could do anything if they just decided to try. He thought about Trevor's questions, about the way his son had absorbed medical terminology like a second language, about the dreams that had been cut short by leukemia. Maybe I could do that, Marcus said. But first, I might need to learn some new things myself. Michael's face lit up. Like going back to school? That would be awesome. You could be a doctor who saves people in hospitals and in ambulances. Out of the mouths of babes. That evening, Marcus called General Torres. I want to hear more about that medical school program, he said without preamble. I was hoping you'd call. The general's voice carried satisfaction and something that might have been relief. There's a meeting at Walter Reed tomorrow afternoon. The director of the accelerated program wants to interview potential candidates. Tomorrow? Marcus felt a flutter of panic. That's pretty fast. Son, you've been running from this decision for years. How much more time do you really need? The truth of it was undeniable. Marcus had been circling around the idea of returning to medicine like a satellite in decaying orbit, getting close enough to feel the pull, but never close enough to commit. Okay, he said finally, set up the meeting. 3 days later, Marcus sat in a conference room at Walter Reed Army Medical Center, facing a panel of doctors and administrators who'd reviewed his military records, his paramedic certifications, and the detailed report Dr. Chen had written about the Michael Torres case. Dr. Rebecca Martinez, the director of the accelerated medical program, was a small woman with steel gray hair and the kind of intense focus that made it clear she didn't waste time on people who weren't serious about their commitments. Mr. Reed, she said, consulting the file in front of her, your combat medical record is impressive. 17 battlefield surgeries, multiple trauma stabilizations under fire, commendations from 3 different commanding officers. Your paramedic supervisors describe your diagnostic skills as exceptional, and Dr. Chen's report suggests you have an intuitive grasp of complex medical conditions. Marcus nodded, unsure whether a response was expected. "What I don't understand," Dr. Martinez continued, "is why someone with your skills and experience has been working as a field paramedic for 6 years instead of pursuing advanced medical training. Most combat medics with your record either transition to civilian emergency medicine or complete their medical education within 2 years of discharge." The question he'd been dreading, the one that required him to explain the choices he'd made when grief was still fresh and the future felt impossible to navigate. "I had personal reasons for stepping back from medicine," Marcus said carefully. "I needed time to process my service experience and some family losses." "Your son." It wasn't a question. Dr. Martinez had clearly read his entire file, including the personal details that explained his employment gaps and geographic moves. "I'm sorry for your loss." "Thank you." "Mr. Reed, this program is intensive. 3 years compressed into 18 months. Clinical rotations that begin immediately. Coursework that assumes you're already familiar with advanced medical concepts. It's designed for people who are absolutely certain they want to practice medicine, not for people who are still processing their relationship with the field." Marcus felt the familiar urge to deflect, to minimize his qualifications and explain why he probably wasn't the right fit for such a demanding program. But Michael Torres's voice echoed in his mind. "You could be a doctor who saves people in hospitals and in ambulances." "I'm certain," Marcus said quietly. "I've been running from this decision because I was afraid of failing again, afraid of carrying the responsibility for outcomes I couldn't control. But watching a child almost die while I stood outside the room because I didn't have the credentials to help, that was its own kind of failure." Dr. Martinez studied him for a long moment. "What makes you think you can handle the pressure now when you couldn't handle it before?" "Because before I was trying to save everyone. Now I understand that sometimes the best you can do is show up with everything you have and accept that the outcome isn't entirely up to you." Marcus met her eyes directly. "My son died despite the best medical care available. That wasn't a failure of medicine. It was the reality of his condition. But if I can use what I learned from that experience to help other families, other children, then maybe his fight meant something more than just loss." The panel exchanged glances, some silent communication passing between them. Dr. Martinez made a note in Marcus's file, then looked up with something that might have been approval. "The program begins in 6 weeks, she said. "You'll need to relocate to the DC area, maintain a full course load while completing clinical rotations, and demonstrate consistent performance under pressure. The failure rate is approximately 30%. "I understand. One more thing, Mr. Reed. General Torres has offered to sponsor your education, but I need to know that you're doing this for the right reasons. This program isn't a favor to a grateful father, and it's not therapy for your own losses. This is about training competent physicians who can save lives. Are we clear on that?" Marcus thought about Trevor's bedside manner with his stuffed animals, about Michael's excitement at the possibility of becoming a paramedic, about all the emergency calls where he'd stabilized patients just long enough to hand them off to doctors who could provide definitive care. "We're clear," he said. "I want to be the doctor I needed when my son was sick. I want to be the physician who can bridge the gap between field medicine and hospital care. And I want to honor the second chance General Torres is offering by becoming someone who can offer second chances to others." Dr. Martinez closed his file and extended her hand. "Welcome to the program, Mr. Reed. Don't make me regret this decision." 6 months later, Marcus stood in the emergency department at Walter Reed, wearing scrubs instead of a paramedic uniform, his name tag reading Marcus Reed, MD candidate. He was halfway through his accelerated program, his clinical rotations demanding but manageable, his confidence growing with each shift. The emergency was a multi-vehicle accident. 3 casualties inbound with varying degrees of trauma. Marcus had been assigned to the team handling the most critical case, a 7-year-old girl with suspected internal bleeding and possible spinal injuries. As the ambulance doors opened and the paramedics wheeled in their patient, Marcus felt the familiar surge of adrenaline, the sharpening of focus that came with life-or-death medicine. But this time, instead of stepping back to let others take charge, he stepped forward. "What do we have?" he asked the lead paramedic, his hands already moving to assess the child's condition. The handoff was smooth, professional, the kind of seamless transition between field and hospital care that he'd participated in hundreds of times from the other side. But now he was the one receiving the patient, the one responsible for the next phase of care, the one whose decisions would determine whether this little girl went home to her family or became another tragedy in an emergency department's statistics. As the team worked around him, Marcus felt Trevor's presence, not as guilt or regret, but as guidance. All those hours in hospital rooms, all those conversations with oncologists and nurses, all those observations of how medicine worked when it was practiced with both skill and compassion. This was what healing looked like, not the absence of loss, but the transformation of it into something that could serve others. The little girl survived. She went home to her parents after 3 days in the hospital, her injuries completely healed, her future intact and full of possibility. That night, Marcus called General Torres to share the news. "The first of many, I hope," the general said. "How are you feeling about the choice you made?" Marcus looked around his small apartment near Walter Reed, noting the medical textbooks on every surface, the residency applications on his desk, the photo of Trevor on his nightstand wearing his Superman cape. "Like I'm finally doing what I was meant to do," he said. "Like maybe some paths are worth walking, even when you can't see where they lead." Thank you so much for watching until the end. If you loved this story, check out the other videos on your screen now. I think you'll really enjoy them. And don't forget to subscribe if you haven't already. See you in the next story.